your time is now, Mr. Shema. He's from University of Rwanda. He's actually a medical student. His title presentation is on bridging the filtration gap, impact of case-based and AI-enhanced learning on renal physiology competency.
Shema Kagaobrez, and glad and I have the privilege to be here in front of you to present my work, which is titled Bridging the Filtration Gap. So I worked with these colleagues you can see here, and some of them are here present. So straight to the background. So going forward to the background. It's not working. So in medical education, renal physiology is often considered as a black box where most of the student struggles to understand deeply the concept. So here, as you can see well, we had feedback mechanisms, complex electrolyte regulation, and the countercurrent multiplication process. So here in this process, students may feel like overwhelmed and they don't really get the concept. So sorry.
Those in the computer rooms should please help the presenter.
The wireless is here. Don't go far from it.
Here is what we call traditional limitation or traditional teaching method. So we have seen that most of the students and also the kind of lecturing processes that we are using are highly focusing on teaching students how to deeply understand the theory they are giving them in the class, as well as you closely to the kind of questions the lecturers are setting. They are really testing the ability to understand. And if you compare the number of the practical exams as well the theory are high compared to the practical. So this poses a limitation where students are not able to quickly move from theory and put them in practice. So during this, we suggested a solution which I called the clinical nephron model. And during our study, we aimed to test the efficacy of this model to bridge this filtration gap. And we tested this model in phase 1 of renal physiology peer learning sessions at the University of Rwanda. So we used a cohort of 85 level 1 students, 48 males and 37 females. And the strategies that we used is in this clinical nephron model, it's not just another lecture, but a three-tied approaches. The first one was case-based learning, the second peer-led, and the third artificial intelligence enhanced. So in this first one, I want you to ask yourselves from the case-based learning and consider two scenarios. A first lecturer is coming to the class, and before delivering his course, he started with symptoms presentation. Let's say like edema, a patient presented with edema, and another lecturer comes to the class and he started with textbook definition. For example, what is GFR? So between those two scenarios, where do you think the learners are going to be more attentive? Yes, of course, the first case-based scenario. So in this model, we used case-based learning to test the ability of learners and make them ask themselves why question. And this why question will take them to look back to the nephron and see what is the real cause of this problem. And for the second period, we just introduced the games as well. guide students in discussing the threshold concepts. So we use some games to help them understand the concept and make it funny. And for the third one, you may ask yourself, why do we bring AI, since it has shown that the AI is decreasing the student ability to listen. So we know that we can't also prohibit learners from using AI. So what if we introduce a technique where students are going to use AI for critique, not just as a source of truth? So here, students, we intentionally generated responses having some errors and test the ability of those learners we used to be able to detect and identify those errors by comparing them to the standard values. So the measurement framework that we use to see the progress of this model, it's just testing the competency, the satisfaction, and confidence. So for competency, we used pre and post MCQs and clinical assessments to evaluate the knowledge gain. For the satisfaction, we used qualitative 5-point Likert scale to assess also the level of engagement. The confidence gain also was tested in this sample of 85 level 1 students. So after all, we have seen that students have gained mastery in this acid-base balance homeostasis compared to the other processes we have seen before. And also, we have seen 78.8 significant improvement in knowledge gain and 21.2% moderate improvement, and the overall satisfaction rate was estimated at the level of 88%. So having all these results, we were able to say that combining integrated peer read and AI critique, we're not just teaching physiology, we are breeding doctors. And this is supported as a standardized approach to advance learner physiology education globally, and it can be also applied to other concepts in the physiology like cardiovascular. It increases concept mastery, breeds evaluative judgment, and enhances clinical skepticism. Thank you so much. Thank you so much for the good question. So we intentionally brought this third technique of using AI because we wanted to teach students how to use AI effectively, because also we believe students are also going to use AI, but we wanted to teach them how to use it effectively. We didn't test the long-term usage of AI. However, maybe in the future, we will test how students are using AI, but in that in that period of time where we tested this model, we were able to see how students are using AI, and they were using it effectively. So I mean, we brought some responses where we tested the ability to identify the errors made by AI. So, and also we taught them how they may even critique it by asking some challenging questions. So we believe they were able to integrate this in their learning courses, and maybe we will also test how the long-term usage of this technique in the future in other studies. Thank you.
Thank you. Thank you so much for your presentation. Exactly what I was speaking about yesterday, about how to develop self-directed learning model. Me and myself, the first module I teach after my PhD was REAN, and I found this very difficult. I have questions. All this being conducted when you were students, so it's all students' activity, or was supervised by faculty member?
Okay, thank you. During these sessions, we were supervised by a medical doctor from UGHE. Sorry, I forgot to mention her. He was the supervisor of those sessions, and we conducted this at in level 1 student, because I'm in level 2. We were taught this lesson, and we go back to teach to the level 1 student to test how this model can be effective.
Okay, one more thing. Can you give me an example of questions you ask AI and how you critique I didn't get how you critique exactly the response. Give me just some examples.
So thank you. As I said, students were able to compare the results, the response to the standard values. For example, I may ask a student, I may even bring a GFR, a definition, as I said, bring a JFR definition with some errors and see how is this student able to see that there is error in this definition. That's how we use this technique.
Thank you, Shema. Thank you very much. My name is Chrétien. I'm a medical student at University of Rwanda. I would like to just add a contribution. In your presentation, I saw why question. It's good for the lectures to first provide some questions before the slides or the time for teaching comes. Yeah, that thing, I liked it. Maybe it can make us students just curious of the subject we will study maybe tomorrow or next week and find some information so that if the lecture comes in, maybe it can be easy. Thank you.
Thank you so much.
We have a question from online participants. The question says, what is your batch strength? How many students for one session of practicals, and what is the duration of the practical session? Do you understand what I said? Let me take it again. What is your batch strength? That's the first question. Then it said that how many students for one session of practicals, and what is the duration of the practical session? That's the question that person has.
Thank you. If you look closely to my presentation, I have said that we didn't go to practicals, but the sessions were conducted in the classroom. So we used 85 level 1 students, 48 males, and 37 females. Those sessions were conducted in the classroom, not in the laboratory. So I can't respond to that question about the practicals because this was conducted in the classroom. I think I'm done.
All right, thank you, Shema, for your brilliant answers. Please can we put our hands together for him. The next presenter is Aristide. He's also a medical student from University of Rwanda. His presentation is titled Lactate as Oxidative Fuel, Why the Waste Product Model Lingers in Teaching. Mr. Aristide, you have the floor now, please.
Good morning, everyone. Good morning. It's all right. Okay. I hope everyone here is doing well. My name is Hakizimana Aristide, and I am honored to be in front of you all like lecturers of physiology. I like my presentation, it wants a change in the way you teach. So I'm very honored to be in a collection of people like you. So my presentation is titled Lactate as an Oxidative Fuel. Like, if you give your attention to the title, you may see that like it's a statement. Everyone here knows that lactate acts as an oxidative fuel, but I'd like you to think like to your first class of physiology. If you can remember well, the first thing that you studied was that lactate is a waste, like it's going to be toxic to the body. That was the first thing that I am pretty sure everyone learned when he started the physiology. But when I was like in year 1, I checked like a YouTube video, but this thing was like nonsense. Like it's simple to take in your mind at that moment, but when you continue forward, you find it's wrong. Next slide. So in my own first year, I watched a YouTube video. Like I was studying for a certain like continuous assessment test, and then I watched a YouTube video, and then the video is, it implied, like it directly told me that lactate is not a waste, it's a fuel actually. Like there are two models that we're going to be comparing today that came from that idea. Like when we start learning the physiology, like we associate lactate with the pain that comes after aerobic respiration, like the exercise where the muscles are used too much. We're going to be comparing, as you can see, the two models. That there's the old model where we have that like outdated thoughts, that outdated idea, and the new evidence that shows how actually this lactate is useful. Yeah, next slide. So, to make this abstract, I analyzed like eight peer-reviewed studies, and because I wanted to debunk like the myth of it acting as a waste, I tracked the papers from 1984, like past that are away from the past, so that you can see that even if the science shows that lactate is not really a waste, the papers have been around for a long time, but we are having a problem implementing it in our lectures. So next slide. After analyzing those 8 peer-reviewed, like I selected the things that showed that had the following criteria, that they could be from a long time back and they were directly related to this shuttle, like to compare those two models. They were directly used to compare the two models. They were directly useful. So, firstly, the things that the key findings. Firstly, the first key finding is that the lactate is like not produced. It's never produced like in short bursts. It continuously produced, even when there is aerobic respiration or no aerobic respiration. The second one, like it was found out that the heart and the brain actually use the lactate as substrate at times. And also in the gluconeogenesis, like formation of the glucose in the liver, it will be using the lactate that as a fuel. And these 3 key findings like will directly contribute to debunking the myth. Next slide. So those 3 key findings, they are crucial in showing that like lactate is not actually a waste, but a fuel. In 2004, actually, these things were shown by Robags. Like I'm pretty sure you noticed 3 of the papers that were in the above slides. So Robags actually mentioned how everything can work. Like the burn myth was debunked by him.
All right, thank you, presenter, for your good presentation. We know that accumulation of lactates can be as a result of tissue damage. So in the course of your research, did you find out the level that these lactates can be deteriorating in the body? Did you find out the level that the lactate can be harmful in the course of your research? Have you known that it can be a byproduct of fuel in the body?
I didn't get that, but the information that you can get from that that's directly relevant to it is just how fast the lactate is used up. It's actually used up in 15 minutes. So that the accumulation, for it to accumulate that much high levels, you should not have any rest for that particular muscle group. So I think they didn't mention it because it actually takes too long for it to accumulate that need to be used.
Thank you for your good presentation, my boy. And I think that we know that normal level of lactate is usual. It is not harmful. It can be used and can be consumed by our body. because it can be changed, as you mentioned in your diagram, back to glucose, and then glucose can be used as a fuel. But my point, within the point our colleague asked, is that it will be harmful when it is accumulating, yani when the rate of production is more than the rate of consumption. And this is definitely will affect the state of acid-base balance. So there will be lactic acidosis, which is harmful for our cell enzymes and plasma enzyme and so. As I want to hammer on the same point, at which level lactate will be harmful, i.e. at which the rate of production, like lactic acidosis, for example, do you have a specific level in that or not?
I didn't specify the levels for its accumulation.
All right, Aristide, thank you for your beautiful presentation. You can have your seat. The next presenter is also a medical student from University of Rwanda. He goes by the name Olivia, and his abstract presentation is titled "From Information Overload to Conceptual Mastery. Reframing physiology education in the digital learning era." Olivia, please, you can have the floor.
Good morning, everyone. I'm delighted to be here as a presenter for my abstract. As you have seen, it is titled "From Information Overload to Conceptual Mastery, Reframing Physiologic Education in Digital Learning Era." As you know, we are in generation where there is more information, more courses, and also more digital learning platforms where everyone can go and get what he's learning. I have prepared this presentation from the abstract and observation we have made in a group of my students where I have worked with those people, and also they are my classmates. Next. From my background, in modern physiological education, we have found that digital learning has exploded in recent years. And also, you know, everyone want to study, like student like me, check on internet, he can browse many data, many concepts about what he is learning. But here I want you to focus on physiology. Also, the student now access huge amount of information, but as we have learned, also one ancient scientist has said that more information is very different from better understanding. That's why I'm here to reframe physiological education by reducing the overload of those concepts. Next. During our study, we have seen that there is a gap between information acquisition and conceptual understanding. You can ask yourself where this comes from. During our learning, we have found that in learning, there is more information, but very different from accepting those concepts. Also, there is weak integration of physiological system and poor performance in clinical reasoning and as well as exam. As you know, I'm a medical student in University of Rwanda, and also there are another faculty that use physiology in their learning. You know, in medicine, if you don't know how to connect theory concept with clinical reasoning questions, you cannot perform well in any hospital or any medical facility you are working on. That's why we have to connect those well in order to perform well in those clinical activities. Next. During our study, we have objectives of reducing cognitive overload, and you will see in our result what we have found if there is eradication or there is decrease of those overload. And also we wanted to enhance conceptual understanding. We will see how we have increased the conceptual understanding, how the student accept where those understandings, those concepts. And also we are aiming to promote integrated learning in physiology, as well this conference is to reframing physiological education. During those studies, we have used different methods to get those data, and what we have found is there is strategies introduced to 100 students. Those were my classmates. We used guided knowledge organization, structured engagement, and reflective practices. And also, we collected some data from the reviewed data from journal published those about. Next. Okay. From the result, we have found that connecting physiology concept and the structural response effective were high, because we proposed those methods where the lectures, from our lectures, I want to acknowledge them, lecture from University of Rwanda, they developed or brought the method of learning where there is more interactive session in the class. Let's applaud them. From that, I want to acknowledge one of them, Professor Ondimo and Professor Feitimi. They give us one hint to study physiology from memorizing them, but we accept those concepts. They say that you have to try to relate what you have studied and environment around you. That will help you to understand those well and get that concept clearly. Next. Those for the result we have found in those studies where there is greater confidence when the students are in all exams. Also, there is improved problem solving, and exam performance were very high when they are using those techniques. Next. Around you, learning become clear and meaningful, which improves application of knowledge as well as clinical practice. This lead to deeper understanding and help to reduce overload in digital learning era. Thank you.
All right, thank you so much. Can we put our hands together for him? If we have questions online, please let's project it. Let's have questions from within us.
Any question?
All right, thank you, Olivia. I guess your presentation was very clear, so we'll move on to the next presenter. Thank you, please. Can have your seats. Can we put our hands together for him, please? Yes, right now we'll be having a presentation from Professor Elizabeth from the University of Kampala International University, Uganda. Her presentation is on promoting physiology, raising awareness and inspiration among A-level science students. Prof, you have the floor and your time starts now.
Thank you so much, East Africa, Rwanda, and every scientist here present. My name is Elizabeth Umoren. I'm a Nigerian, but I teach in KIU, Uganda. Like you've seen, the title of this presentation is Promoting Physiology, Raising Awareness and Inspiration Among A-level Students. It's a project title in the sense that this is a grant-awarded project. And then when I looked at the team for the Rwandan organization for this physiological presentation or scientific conference or gathering, I found this fit to bring it up so that it can also fit into the theme. How do we promote physiology? Please, next. The background of it stems from the fact that when I came into KIU, I met other colleagues of mine. Some of them are here, like the likes of Dr. Nadipo Lufunke and Professor Owu. And I looked at it, I told them, what is happening? Physiology department seems zero enrollment. And I was like, where we are coming from, we can't even manage the number of students in physiology program. But here we are, zero enrollment of students. And I looked at the future of the physiology program. And I said, if I have opportunity, that I will go up and advocate, sensitize students to create awareness that there is a course known as physiology, which is the bedrock of modern medicine. And its significance, it's not all about medicine. MBBCH, which, in fact, I took it up with my proprietor, and he said, yes, that's the in thing here. It takes a whole time to really advocate and let them know that there is a physiology to sensitize them and bring them into the field. Because I was actually looking at the depth of physiology when the old hands like Owu and I and many others who are coming, and these are internationals, what's the future for Uganda in terms of creating and keeping physiology to actually mother the biomedical and the MBBCH program. That's the background. So I have already explained the need for action. And then when I talked to my colleagues, I said if we have the opportunity, we should go out and create awareness, sensitize these A-level students, and let them come into physiology. That's exactly the need for the action, which is what we did on this project. Please, the next slide. And then we went, we talked to 5 schools, 5 A-level schools, science, and then they gave us the students, and then we were able to spark that curiosity in them. We created awareness, and we spoke to them the soul of physiology and what it is all about. And we were able to really crave their indulgence, and they showed up in some of the methodology we use. They showed up their interest. Please, the next slide. All right, like I said, there was the outreach, interactive outreach and engagement of these A-level students. We used facilitators such as peer mentors. When I say peer mentors, there are some of the postgraduate, in fact, masters and PhD students in the program currently in KIU who are MBBCH holders. And then they came back to do physiology. So we deem it fit to use these as ambassadors to speak to their younger ones, to crave their indulgence and create awareness for them to come into physiology. And that we achieved it. Because they said at the end of the day, having a 10 MBBCH, what's next? Some of them expressed the way that it was almost impossible for them to remain in the clinical unit all their lives without any, those exploration and changes accompanying life, that there is a life after, the clinic. And then they were able to synthesize and actually create that awareness in the students.
Please hurry up.
Thank you. Then, move, please. I've captured all of that. Move down. These were our key findings. Another thing I would like to say here is that the sex demographics is really interesting. We saw there in Uganda, maybe because of my case study unit, the males are more in school than the females. Yes. You drop. And then we use questions like, have you ever heard about the course physiology? And you can see the percentage yes and no. Go down. And then we also said, do you have interest in pursuing physiology as a course of study in the future? You can also see the expressions there. A lot of them indicated interest. And we also did some of those sessions and we asked them questions. Which session did you enjoy most? You can see the pulse and respiration practical, simulations were what was there. Let me just run down, please. Just run down. Let me go to my conclusion. Yes. There was really an impact. I'm very sorry to take your time. Student feedback reflected a clear understanding of physiology's concepts and their career prospects in them. And then they were requests from non-participating schools to replicate the program, create their awareness such that they can come more into physiology. The project team intends to expand the outreach to additional schools, leveraging the goodwill and interest that is generated. Thank you so much. Thank you very much
for the presentation. It is now open for questions and comments. Right. Questions?
Yeah, there is a question there.
Yeah, thank you, my professor.
Yeah.
I'm called Herbert from Kabbalah University. Yes, thank you for promoting physiology in Uganda. However, I don't know if you have the plan of looking at the stakeholders, not just the students. That's like the public service. Even the chancellors of universities and the deans of the different universities. I think some of them could even be here that still have a thinking that if you are not a medical doctor, you cannot teach physiology and you cannot learn physiology. And therefore, as a physiologist in Uganda, you have no job if you have no medical background. So as we bring in these students from high school, the government needs to be aware, public service. Partly our work should also actually go to them first and the deans before we go to the students themselves. Yeah, that is mine. I don't know, I was thinking maybe for the future, if we can also do maybe like a cohort study and follow them for some time and see the job opportunities. Where are they going to be? I have my colleagues, more than 10 years after getting masters in physiology, they have no government job. Becomes hard to convince. Thank you.
Thank you so much. Let me quickly respond to you from your first, concern. It's a policy, thing. And I have mentioned this, like I said earlier, even there's another forum I presented this, and they also raised that concern. The parents, the key stakeholders, the government itself. In fact, the aspect of you talking about them having to obtain MBBCH before even appreciating physiology has never come on board. So there is really a lot for we stakeholders as physiologists, if you are really wanting physiology to stand the test of time and really have the stay it has in biomedical sciences, we have a whole lot of work to do. Thank you so much. Yes, yes.
All right.
Yes.
Thank you, Ma, for your push. I'm afraid that we've run out of time.
Thank you so much. I'm down.
Please, if you have a question or a comment, you can see her in person. Can we put our hands together for her, please? Our next presenter is from King Abdulaziz University. The person is Professor Lamis, and she's presenting an abstract titled Students' Satisfaction Regarding the Application of Crossword Puzzles.
Good morning, everyone. I don't know how it will be interesting after all these interesting presentations and excellent presentations. I'm being lucky to attend ESAP for the next time. Okay, this was done during the COVID era when we have online teaching. We want to relate of how can a student be involved. So we consider about using cross puzzle. Next, please. It's all said yesterday that physiology is essential basic science. However, always medical students in general complain that physiology is a difficult topic to understand. So we have to rely on different teaching and put in mind that students have different learning styles. Again, we know that lectures is a passive way to teach physiology. Next. So cross-puzzle as innovative and fun approach for students. This already been documented in literature, and develop their thinking skills. And puzzle offers students opportunity to evaluate and assess their knowledge interactively, give them self-reflect. Previous study reveals that effectiveness of cross-puzzle in revising and memorizing cardiac cycle terms and events. And you can see the reference. Next. So what's our goal? In spite of cross-puzzle is well known, but during online learning is not well documented. So we aim to investigate the student perception of cross-puzzle and potential sex difference to best of our knowledge. This primary study to explore this topic. And why we use, because in Saudi Arabia, most of the universities, there is female campus and male campus. They taught differently and separately. This is why we look for gender differences in learning style. So we have preparation phase. It will include third medical students. And the puzzle we're creating using an online tool is crossworduniverse.com. The questionnaire was basically in Arabic and then translated for the sake of publications. The application phase, the lecture was given online, so we have used Blackboard Ultra Collaborate, followed by a brief session for solving the cross puzzle. The puzzle viewed on the screen, student given 5 minutes to think and prepare their answers and solve the puzzle use the chat window. And the teacher then correct via the microphone, and they are able to work together to solve the cross puzzle. Then we ask them to get satisfaction through Google Form, because at this time there is no face-to-face interaction. And we can see here the results. Next, please. This is an example of one of the cross puzzle. Next. Why we choose cross puzzle? To enhance the students to memorize, to recall, and to write. Unfortunately, I think all of us, maybe most of us, use MCQs mainly as a tool of assessment. Now students actually stop writing anything at all. And you can see that it's come that even 6 medical students, if ask him is there any disease, he will find difficulty in writing. So this is why we choose cross puzzle. So our results, 75% strongly agreed games are interesting and emphasizing method in physiology education. And strongly agreed games are effective tool of communication, both between students themselves and by teacher and students. And 70% agrees that cross puzzle is an interesting interactive online, can be used, and strongly about 65% agreed puzzle help to memorize the definition and terminologies in physiology. And almost 78 also agrees that cross-puzzle was a good at the educational practice of physiology, and we find no difference in response between males and females. So, in our conclusions that joyful learning is necessary. Having lecture after lecture after lecture is boring for both of us educators and you students. Gamifications, and thank you to the initiative of Professor Abdul Latif, is addition to physiology teaching, and now it is not addition. I believe now it will be a cornerstone of physiology education. Cross-puzzle can promote the different learning styles as kinetic, visual, and what we want to be interactive. Blended teaching practice is quite necessary. We should have, it's online should not only be considered during the outbreak, it should be a part of physiology teaching. This is our paper published in Medical Science Educator. Thank you so much for your time.
Awesome, Prof. Thank you for a perfect presentation. The time was perfect, your flow was on point, and you were very easy to follow. Please, her presentation is open for discussions. If there are questions online, please just project it. And if we have contributions here.
Thank you for the presentation. It is just to know whether there is a link that students can use to access the cross-puzzle in case they want to use it, or maybe any teacher may want to use the cross-puzzle for their students. Is there a link they can click to access this cross-puzzle?
Actually, we use the link. We want to create our own cross-puzzle and then deliver to students. We didn't make a link to create our own, but we will think about this. Thank you so much.
All right, thank you. We will draw the curtains here for our abstract presentations. That's just a word to put across to all of us. We see that there is a need for us to get more into research within the teaching of physiology in Africa. Hope our next conference or workshop we would have more abstracts submitted. Thank you.
I was very honored to have this question to moderate this session by Professor Abdul Latif. So I was very honored at first, but then I started to be very worried because most of the students we have at KCMC know much more about using AI than I do. So that's a bit of a difficult issue for me at this moment. But if you want to learn to swim, you have to jump into the water. So I jump in the water now in terms of AI in teaching. Okay, some historical background. Sorry, I will stay here. Actually, the AI started already quite a long time ago. And actually the founding fathers, and I put very young images of them on the screen just to stimulate also the students in this room that they can really make significant contributions in their life. So Donald O. Hebb was a Canadian neurophysiologist who was very influential in understanding of how the function of neurons contributed to the physiological processes such as learning. And his a principle which is named after him is neurons that fire together, they wire together. So actually it's the adaptive nature of neurons in our brain which allow us to learn, allow us to teach, allow us to forget. The other person who is very influential is Alan M. Turing, who is actually died tragically in 1954. He was a British mathematician and computer scientist who laid the foundation for the modern computing and AI. Actually, he broke the Enigma codes during World War II which were beneficial and saved a lot of lives, because the British know when the Germans were to bombard London. The Turing test is named after him, and it's actually a test which asks, can a machine think? And actually the idea is that you have a judge who asks questions, but he doesn't know if it's a question to a computer or to a person live. And from his prediction was that by 2000, the advances in AI would be that much that it would not be possible anymore to do this. That you could not discriminate between a computer or a human. Actually, when you use a help desk, for instance, you don't know if you are helped by a computer or a bot. And actually, this is a bit of a kind of... So what kind of questions do you ask to know if it's really a computer or not? The outline of this presentation will be that I will give a little background on neural networks. And as I already mentioned, Donald Hebb was one of the founding fathers of the design of neural networks, which are actually the foundation of artificial intelligence. So actually, as a physiologist, we can claim that AI is ours. The basics of AI are to be found in neural networks, which were designed by physiologists, in fact. So I will look at the types and applications of neural networks. I will look at the risks of large language models, so like ChatGPT, and also the risks of machine learning. Next, so this is about the physiology in AI. Then I will talk about AI in physiological teaching, the ethical use of artificial intelligence, key challenges, and an example of the asset-based balance analysis. And since our short session has been shortened to 1 hour in total, I have to be ready in half an hour. So I'll try to do that. Well, neural networks are computing systems inspired by the brain, and they form the backbone of model AI. They consist of layered nodes which resemble neurons that process data, recognize patterns, and make predictions by adjusting weighted inputs. The applications are numerous, and you all know them. Image recognition for finding breast cancer in, for instance, natural language processing and autonomic driving of cars, etc. If you look at a neuron, which is of course very familiar to all of us, we have the central part, the nucleus with the dendrites. We have the axon, and we have, of course, the axon terminals. And actually this is, so you can look at the neuron as you're having the inputs from other neurons, which are via the synapses, and the outputs, which are the action potentials which arrive at the synapses. Well, this can be also modeled mathematically, and it's indicated as such that we have actually several inputs, like the synaptic transmissions in various parts of the dendrites. They are processed in the neuron and give rise to, via an activation function, into an output. Here we see a kind of neuronal network at the top. And one of the basic ideas of the modeling of neuronal networks is that you have layers of different neurons. And actually the communication between the layers is, the gain in the communication between the layers is adjusted during a learning process. So if, as a child, you learn how to walk, It's actually an adjustment. First you fell down, you stand up again, you try again, etc. And actually in this process you tune the gains of the neuronal network, and ultimately the end result is that you are able to walk. In AI, we have similar arrangements. We have an input layer. We have what's called multiple hidden layers, and we have an output layer. And actually the idea is that these layers communicate. From the input, you get an output signal, a prediction, for instance. So we have interconnected nodes or neurons, and each connection has a kind of weight in the connection, and it also, which resembles the importance of the connection. The input layer receives data, and it can be kind of, for instance, pixels from a photograph, from an image. The internal part, the hidden layers, are actually the workhouse of where mathematical calculations are done, which are used to extract abstract features, for instance, from an image. So, for instance, you have an image, there's a dog in the image, and by kind of calculations, the system knows that this is a dog. And the output gives a classification. We have dog, we have a tree, we have a mouse, we have a whatever. Actually, there's a basic principle in the learning, which also resembles the neuronal networks in our brain. And this is called the back. The first thing is that the accuracy of the prediction is compared. So you give a certain number of inputs, and if the predictions are false, there's a big error in the system, and you look at this. So there's a prediction is made by comparing the correct answers with what you had in mind. And this is called back propagation. So you have an error, and actually by mathematical calculations, you try to reduce the error. So the learning in the AI model is a kind of adaptation of the gain in the connections between the different neurons. To give you a short example, the email detection, the spam detection in emails. You all receive emails every day. And of course, we are faculty, staff, we are students or whatever. Well, if you have sometimes an email has a congratulation. So sometimes you have a congratulation. Well, the chance that you have an email in which tells you that you have a certain price gained or whatever is not very large. So it has a higher as weight. Something free. Nothing is free in life. So when you have an email which has free in it, it's debatable. Also a bonus. Which of you students have ever received a bonus at the end of the month? Never, I think. Anyway, so you have weights to the certain words, and then just the computer looks at the occurrences of these words. So, for instance, congratulations is mentioned twice in a certain email. Free price is mentioned twice, etc. A bonus is mentioned twice. So then you calculate the relative frequencies of this, and you compare this with what's called a bias. And this is actually similar to the threshold in the action potential, in the membrane potential, which causes an action potential. So for a neuron to fire, you need to exceed the threshold, and this is called the bias. So now we do the calculation, and we find that the output is 2. output is larger than 2, and this is considered spam. So in this way, you have a kind of mathematical model which gives you a clue on how to interpret a certain email message. Now you can give thousands of email messages. You look at the results, and you see how well the program works. And if it doesn't work well enough, you try to improve it. So for different tasks, we have different workhorses in the central core of the model. And actually, so we have the simplest models are what's called the feed-forward models. And these are very simple things like the example which I gave for the spam detection. The convolutional networks are networks which are specialized for processing images and videos. They use, in fact, filters or contrast enhancement to find boundaries, etc., etc. And they resemble, in fact, also the neurons in our brain. We have the different types of neurons which detect lines or translations of lines, etc., etc. The simple and the complex cells in our brains. The recurrent networks are used for speech, and they resemble the reverberation circuits in our brain, actually. The transformers, they use the general AI tools which you know of, and they use self-attention prompts to process entire sequences of data at once. And they are the ones who are used in ChatGPT. Simple models use a kind of layer of 3 neurons in the design. ChatGPT uses about 20 layers in the lane. So by adding complexity in the calculation, you can also make more complex models. The final ones are the generative adversarial networks, complicated term. And actually, it's a network which has a generator and a discriminator, and it works like neuronal networks which facilitate or inhibit the signal transmission in the brain. Risks of large language models and machine learning. Overfitting and hallucination are terms which are often used. Actually, hallucination was also a term which was used by Hepp in his studies, and he attributed hallucinations in people to loss of inhibition in the neuronal network. To illustrate, well, I skipped this for the sake of time. How much time do I have left? Sorry? 4 minutes? Sorry? 10 minutes. Okay, thank you. Well, I skipped this one for the sake of time then. Well, the key challenges, they also have been discussed also already earlier this morning. So we have the cognitive offloading, as it's called. The students are at risk to have become passive learners. They just retrieve information. They ask the AI to do a job, a student presentation or whatever. There's ethics. Of course, ethics is in generally the discipline which debates which is morally right or wrong. If we think about ethics in AI, it's the governance of AI's behavior in terms of alignment with the human values. So the ethical use ensures that the programs are developed and used in ways which are safe, fair, and beneficial to the society. One of the key questions in at university actually is what you could call the ask a friend's test. So when is the use ethically approved or ethically wrong? Well, proofreading and grammar check spelling are examples of what you could say accepted use of AI. But if you would ask your friend to make the planning or to write an essay for you, of course this is not ethical, and it's also not ethical to use AI for this purpose. So in conclusion, I think nowadays definitely AI models will improve any further, but at the moment I think at least my impression is that you should use AI as an assistant, as a search engine such as PubMed or Wikipedia. You can get ideas from it, but you have to be very careful in the use. You have to keep into control and accept responsibility for what you do or make. The example which I would like to illustrate to you is based on the acid-base balance nomogram as it's in many of the textbooks, and this one is from textbook of Guyton. So we know that acid-base is difficult, the balance understanding is quite difficult, and actually we know we have arterial blood pH, we have the bicarbonate concentrations, and we have the partial pressures of carbon dioxide. And this determines whether a subject has a certain type of disease or not. So normally in teaching, I use the example that, well, we have a patient with pH 7.3, bicarbonate 12, carbon dioxide 25. So we look at the graphs, we look at the intersection points, and we see this patient has metabolic acidosis. We can go to the second and the next, and I will skip this for the sake of time. So now an example which you could try on your computer or your mobile phone yourself. I think most of you know how to approach ChatGPT via the Wi-Fi. I'm not sure if it will work if you are all doing this together, but let's try. So you just type ChatGPT in your search in Google, and then you will find access. So you can ask a question simply. Generate a case study for a patient with an acid-base disorder. It's a simple question. You can ask it to ChatGPT, and it will come with an answer. Actually, this example was from a paper published by the Davis, as indicated at the bottom. So if you put this in your computer, and I don't see many people trying it, but if you ask ChatGPT to generate a case study, is anyone got a kind of case study which came out of it, of the search? Anyone who got a patient case?
Case of anemia.
Anemia is that's what, yeah, you cheated. You didn't use ChatGPT for this. Anyway, it's definitely one of the examples. Well, if you try this, you will find something like type 1 diabetes patient with weakness and respiratory distress. Well, this is a very general case, and well, the authors found that for the students, you don't want to have the diagnosis at the end. So the next step is you can also, the next prompt was generate a case study with pH values etc., without a diagnosis. So you can also give ChatGTP exclusion criteria not to use something. If you do this, you get a COPD patient undergoing extensive abdominal surgery. This patient had acute acidosis caused by CNS depression by opioids. So that's actually, the students should try to find out from the case study which is presented by ChatGTP in this way and come to this kind of conclusions. You can also, from this point onwards, you can make the case more complex. You can ask, actually that's what I wanted to know. We know we have CNS depression by opioids, but how does the treatment of opioids really affected gave rise to the complaints of this patient? And if you do that, ChatGTP comes up with a very nice study explaining the control of the respiratory centers and etc. and with very much details which enhance, I think, the learning of the students. And I think ChatGTP is very widely accessible, and I just want this to see as a kind of promotion for you to try to use it, and also to try to think in designing of your teaching in how you can, for instance, make case studies or cases, design cases, and have self-directed learning, and then group discussions later in which students maybe compare the outcome from ChatGTP with Gemini and Grok or whatever, but there are many options which can be done in the future. And by this, I would like to thank you. Any questions? Our chair or... Sorry. This is just to add some drama to the whole presentation. I was looking for you, actually. Anyway, so any question after this? Yes. Oh, sorry.
Thank you so much, Professor, for this excellent presentation, and thank you for the rule of ask a friend. It's make very complex, very easy. So you can just, is it ethical to ask a friend, is it cheating or not? Actually, when I asked the question to the ChatGPT, I got the cases with so much drama and too much details.
Yeah.
So how can I ask more specific questions to get a case study that will be suitable for students? Because when I got so much drama and talk and stories.
Yeah. Now, I think it's part of the learning process for the students as well. So I think there are, of course, tricks like the exclusion criteria, which I mentioned. So you can specify, for instance, that you just want to see disorders, respiratory disorders, or metabolic disorders, or whatever. You can specify to patient groups like diabetes or heart failure or whatever. So I think these kind of exclusion criteria can be looked at. But I think for the learning experience, it's very good that the students really see this diversity and make their own path to come to the... I think in the end you should design for this kind of assignments, you should design very clear output criteria. So what do you want to know? What do you want to know the students to know in the end?
All right. Thank you, Prof, for your presentation, and also for drawing a caution on hallucination that you have in the use of AI. However, looking at the fact that we are looking at teaching physiology, using the AI and all of that, looking at the available AI tools, which one do you think is less prone to hallucination when it comes to teaching used by students, for physiology, sir?
Well, that's a question I really don't dare to ask at the moment. I mean, there is also, in the current AI programs, there's a lot of learning still going on. So the AI is still also learning from the inputs which are given. Actually, that's one of the risks I wanted to share with you as well, that you have to be very careful if you use it in research, for instance. If you put your conclusions in AI, AI will use these conclusions in the modeling later. So actually you release some of the novelty of your data by putting it in AI. But no, about the discrimination, which one is better, I think the students know far more better than you what is the best program at the moment. Okay. Any more?
Thank you, Prof, for that wonderful presentation. Do you see a scenario where in the future the textbooks will become less relevant even as AI advances? Do you see such a scenario in the near future?
Yeah, definitely. I think the writers of textbooks need to become very worried. They will have no income left within, my prediction is in a few years' time. Also, the textbooks, the soft copies are widely available. So actually, I made a mistake in buying new editions of Guyton. Actually, you can find it on the internet easily. And I think also in terms of content, I think a lot of the textbook information, like encyclopedias. When I was young, my parents had a big bookshelf of all encyclopedia from A to Z. It's not used anymore. I think the same fate is for textbooks, I think.
Any other question? Well, if there's none, we shall proceed to the next.
This segment is the second half. This workshop is about ethical use of AI, generative AI, in teaching and an assessment, especially in physiology, but it can be used for any aspect of medical education. So we're looking at using Gen AI tools for assessment, and by the end of this session, hopefully, you would have explored how AI can be used ethically in assessments. You would practice designing AI-assisted but human-validated assessments, and hopefully you'll be able to ensure assessments remain valid and fair and academically rigorous. That's the purpose. All right, next slide, please. So assessments, we all know, is part of what we do. We're either assessing for learning when we do our continuous assessments, and for learning means that it allows students to take a break and understand or assess, see the gap in the learning and try to fix those gaps, or even we see those gaps in the feedbacks that we give them to aid them to plug those gaps. So assessment for learning. Assessment of learning is what we do at the end of the day. Okay, that allows us to decide who is going forward to the next year. So those are summative. Assessment as learning is what we use the feedback that students give us for when they give us meaningful feedbacks. Sometimes students misuse the opportunity of giving you feedback. They give you feedback that is useless, that you cannot use to make your program better. But what that feedback that we want from them is actually supposed to make the program get better. So we do a lot of assessments for these reasons. Next slide, please. So why must assessment change in this era of generative AI? You've heard from Prof. Gare. Students are already using AI tools, whether you like it or not. Okay? You cannot stop them. My institution says we should even encourage them to use it. But encourage them to use it how? Ethically. So we know the students use it, Whether your institution says you should encourage them or not, they're using it. So assessments do need to change so that we don't lose the validity of what we're trying to do. We agreed yesterday that physiology is a living science, which means we must always, it's about how, why is this happening, mechanisms. So we want our students maybe to reason also in that direction. And therefore, we cannot continue to examine the way we were doing previously and expect that we are actually assessing learning. Are we together? So this is why assessments need to change. Now, AI tools, we're not saying that the AI tools will be used in all the types of assessments that we give students. However, a lot more students are depending on AI as their primary source of learning. Prof was just asked, are we sure we're going to be using textbooks soon? After a while, won't textbooks go out of fashion? Right now, a lot of students, you practically have to explain and plead with them to use textbooks as their primary source. Okay? We've done experiments in my university trying to get them to understand the difference between the information they get on AI and information from textbooks. So AI would give you information that looks plausible, but they're just flimsy. They don't explain why. Students don't understand why. But if you also use AI to draft your assessments without understanding that, AI will give you questions that would answer or that would allow students to answer those questions based on the flimsy information it has fed them. Are we together? Am I making any sense? So you have to bear that in mind if you're going to be using AI as for assessment, in drafting your assessments. Can we go on? So the core principles remain the same when we are using AI in terms of using it to draft or construct our assessments. Validity. Are we examining understanding? Are we examining knowledge of concepts, interactions? What are we examining? Is it fair, this question, that your choice of using AI in assessments, how fair is it to all concerned? Because there will be some students that are very good with different types of AI tools, and there's so very many of them, and each one of them is good for different parts of learning. And some students know all this, whereas some students are just learners. They're in the same class, in the same school, but they don't have that much access. All right? So is it fair? Are you still, is the exam assessment tool, whatever you've asked AI to do for you, is it fair? Okay, that's what I just explained. Is it transparent? Have you told your students you're going to be using AI in any part of your assessment? Because if you are going to use it, you must declare to them. All right? And accountability. What is your role in using AI for assessment? And we'll talk about this as we go on. Next, please. So there's some things that you can use AI for, which is ethical in assessment, and there's some things that you must not use AI for. So AI will help you to draft question stems. AI will help you in even creating plausible distractors. It would help you in suggesting case. Prof just told you a while ago, put it in AI, create cases. Okay, it can help you create cases. And it can even help you structure the rubric that you would use in marking the essays or whatever assignments. All right? However, although there are AI tools that are used for grading assessments, they should not be the final determinant of a student's grades. That is our rule. Okay? They will assist you, but it is not their job. The AI tools should not replace academic judgment. That, again, is our job. and it would not assess nuances or originality. AI will not readily know that there is a difference between somebody maybe who works 1 kilometer in Nairobi and somebody who works 1 kilometer in Kigali. All right? You know, the students should also know. These are the things that we must never delegate to AI. So you use AI as your junior assistant, just as you would not allow your assistant lecturer to give you a draft of an assessment or a question, and then you use it, you just sign your name without looking through. You cannot do the same with AI. So the responsibility is still ours. That's what I'm saying. By the time you delegate these three to AI to do, then you've crossed the ethical line. It would no longer be an ethical use of AI. Next, please. So, I mentioned earlier that because AI gives very simplistic, not mechanistic information on different subjects to students, those students who depend on AI as their primary source of information and who do not have a deep knowledge, if you use AI to draft your MCQs, I can tell you they will score 100%. Because without moderation, without your intervention as a professor or as a teacher, the MCQs that you will get will just be seeking recall. It will just be asking for recognition of simple things. What is homeostasis? One answer. You are not asking them to link things. You're not integrating, asking questions about integration. Okay? So even the distractors that AI would give you would be so easy for the students. Oh, this one is wrong. Okay? Sometimes you use AI, it's already giving cues, giving the answers to the question in the STEM. So that is your job to sift out. And what do you want? You would rather have higher quality MCQs, okay? Which will test the actual knowledge, the actual learning of your students. So you will be asking them about interpretation of unfamiliar data. What happens if there is a perturbation in the system? You know, predict a response. You are asking about integration, which I've mentioned, and also what is the best explanation of this scenario. So look at the example on the left. That was the way we used to examine what is the effect of parasympathetic system on heart rate. Yes? That was 20 years ago. Try that now. Everybody will score 100%. All right? So now you need to put concepts, ask integrative kind of questions that will make your students think, not just one question. Okay, this PM, what's the effect of standing up on blood pressure? PM, what's the effect of eating rice on blood sugar? PM, no, we can no longer do that. All right, next please. So now we'll give you 3 minutes, and that's why we needed to have people with access whatever AI tool you're familiar with or you would like to try. Choose any tool of your choice and answer any of those questions, 1, 2, or 3. Create an MCQ, just one MCQ. I can't see anybody. Create an MCQ. Work as a team. If you have 1 laptop or 2. Or create a short answer question. Ask ChatGPT, Copilot, Gemini, whatever it is you are using, tell it to give you 1 MCQ on something, just 1. Or create a case-based data that you want your students to interpret, just 1. You should have the answers by now. It takes 0.3 seconds for ChatGPT or Copilot or Gemini to give you an answer. leave the second part of guidance. Just ask the question first. Just create one MCQ. You have one? So you tell us the prompt. You tell us what you told the tool to say, to do, and then you tell us the response. Please listen.
Thank you. I have a prompt that says that give me an MCQ on renin angiotensin aldosterone system. The question it gave me is which organ releases renin in the renin angiotensin aldosterone system. There were 4 options: A, the liver; B, kidney; C, adrenal gland; and D, the heart. I think the answer...
That's not the purpose. The purpose is you gave it a prompt, it gave you a response. Can we get what you have here, please? Do you have anyone ready? 0.3 seconds? No? All right. Who has one more? All right. Where is nobody to help us with the mic today? At least I'm getting my steps in.
Yeah, so the prompt was generate an MCQ on phases of action potential. So the MCQ reads, which phase of the action potential is primarily caused by a rapid influx of sodium ions, puts sodium in brackets, into the neuron, and gives 4 options: A, repolarization; B, hyperpolarization, depolarization; and then D, resting phase. Gives us the correct answer and explanation.
Thank you. Now we've heard 2 questions. Those same questions that you asked, the 2 of you at least, now do a follow-up prompt, okay? Specify a learning outcome or a cognitive learning, level of the students that you want to give that exam to. You could say something like, this question is for Year 3 students who have completed their modules in medical physiology. Let it include application or analysis, something like that, and then let's see what it says. And others, please do the same, because by now you should have the first response. We want to reiterate, we want to continue interacting on that same question that you asked initially and see how it will change. All right?
I have just told it that to specify and make the question for reasoning, not just recalling. The question it gave me, it states that a 65-year-old man presents with severe dehydration after prolonged diarrhea. His blood pressure is 85 to 55 millimeters of mercury. Laboratory findings show reduced renin perfusion. Shortly afterward, his body activates the renin-angiotensin aldosterone system. Which of the following physiological changes is most likely to occur as a reason of renin-angiotensin aldosterone activation? A, increased sodium and water excretion by kidneys. B, vasodilation of systemic arterioles. C, increased aldosterone secretion leading to sodium retention. D, decreased reabsorption of water in the distal nephron.
Thank you. So you can see by giving it more information or more direction, the question is getting tighter. Now, even if we stay with this question, as professors in the room, would you give this question to your students just like that? Any lecturer, any professor? You heard what he read out. Would you give that question out to your students just like that, as it is, or there's something you are not comfortable with? Anyone? Please listen again. A 65-year-old man presents with severe dehydration after prolonged diarrhea. His blood pressure is 85/55 millimeters of mercury. Laboratory findings show reduced renal perfusion. Shortly afterward, his body activates the renin-angiotensin-aldosterone system. Which of the following physiological changes is most likely to occur as a result of a change in, as a result of the renin-angiotensin-aldosterone system activation? And then it lists the options. What do you think about this question? Would you give it out to your students like that? What would you do? What would you modify, if anything? Yes. What is it you are not comfortable with? Can we have the second mic, please? Pass. Thank you.
I think one of the changes I would make is in the stem of the question, it has mentioned activation of the renin system. And in the answers, there's a response on aldosterone activation promotes. So already that's a leading answer. It already gives you an answer already. So I would remove that bit on the RAS activation in the stem of the question.
Yes, absolutely. So this is why we said you cannot take the question or the assessment, whatever it is, whether it's MCQ, whether it's essay, whatever it is you ask AI to generate for you, you cannot just take it and use it directly. You must intervene. You must take responsibility for the outcome or the output from the AI. Are we together? All right? Next slide, please. So this is what we would have done, but we really are running out of time. We have to shorten, but it's the same exercise of, you just must take responsibility. You cannot just give it to AI to do and then you give it to the students. You must put your note on it. Next, please. So what we are saying is we want to take into cognizance that our students are using AI. There is no way you will stop them from using AI. It's like asking people to stop using calculators and go back to using 1+1 or, 4-figure table, whatever it is they were using in those days. So that, is something we must accept going forward. But we still need to design assessments in such a way that it will measure what assessments are supposed to measure. That's the essence of this exercise. So you must learn by practice how to design these types of assessments. And as I said earlier, we are not going to be using the traditional assessment methods. You will have to become creative. Some of the things that we have done, and I've heard in some of the presentations earlier, is also generating AI output with negative or wrong information and having students criticize that output. Some students, anything AI gives them, is correct. They even argue with us in class. Oh, this is correct because AI says so. Okay? So, but if you make them criticize what AI has given them as an output, they become more critical of whatever they're getting from AI. And you're not going to give them take-home essays, because that's just a waste of time. All right? If you're giving anything, even in class, put it in the AI and see whether AI can give you the response in 3 seconds. If it can, then it's a useless assessment. You want to ask them things that will tax them, that will make them reason. I gave an assessment, I think, late last year, and I said something like this. using an analogy of a city plumbing system, explain to a patient's relative the effect of hemorrhage on your patient. It's like, but if I had said, write an essay on effect of hemorrhage, pium, 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 pium. But it's still the same thing. But now I have asked them to think, what part of the city's plumbing system will be the heart? What part will be the arteries? What part will be the veins? What part will be doing what? And that made me understand, realize who actually understood what we'd been talking about. So those are the kind of assessments we need to start thinking about. Next slide, please. So we're going to do this, but we don't have time, but it's still the same thing that we started with. Just that same question that you gave earlier, just keep, tightening it. It's called reiterating with the AI tool. Keep prompting and changing your prompts and making it tighter, and you'll know when you are happy with the question. Next. So you can use AI ethically to do these things, as I mentioned earlier, but the ones that are non-negotiable, you must intervene. As a teacher, as a professor, whatever role it is, you must intervene. You must be transparent to your students. They must know whether you are setting with AI, whether you are grading with AI, whatever it is you're doing, whether they are allowed and what aspect of your course they are allowed to use AI for. My university has guidelines, and you have to declare to the students, you're allowed to use AI to do this, you're not allowed to use AI to do this. It must be clear. No ambiguity. Next, please. So, again, you can use it to draft your rubric, but you must look at the rubric. What has it asked in the rubric? What is it asking you to mark? Okay? And if you're going to use AI, I've had colleagues in different workshops who said, yes, they use AI to grade, but then you would still have to go through and look at the grading, because AI is just going to pick words. If this word appears, 1. If that doesn't appear, 0. But you will be able to look at the way the student is thinking, marshalling their thoughts, putting their points together, and whatever it is you are grading. So it's not just grading fluency. Fluency is not the same thing as understanding or application or analysis. All right? Next, please. So I've talked about this, what the students can use it for, what they may not use it for, and all that. Next. So AI can enhance the way we assess, but only if we're smart about it, we're up to date about it. We cannot just say, somebody told me, give me 100 skills. If you follow what they did just now, you should sit down and make sure that those 100 MCQs meet up with standard. It's fair, it's valid, and it's what you want. Not just 100 and you print them and take them to your students just like that. All right? That is not what the AI is for us. Okay? Human judgment must always be used, and that is why it will always be relevant. Okay? AI will never replace us, but AI will replace those who are not. Make sense? It's not going to replace you. But the more but you cannot hide. It is not going anywhere. Besides, the industry expects them to be AI literate. Health records. So your students will be at a disadvantage if you prefer. So we are need to implement our trade. Next, if there's any. All right, so think about it. The assessment that you would like to modify or you would like to AI in the next semester or trimester, and what policy that you would be clarifying for your students. All right? That would, if you can do that, and you actually do redesign any of your assessments, bearing in mind that AI is here to stay, then my job would have been done. Thank you very much.